Madam Chair, Honorable Regional Minister, Deputy Director of Human Resource, the Chief Nursing Officer, the Municipal Chief Executive, fellow national executives of the Union, the National President of Union of Professional Nurses and Midwives Ghana, the district executives, colleague nurses and midwives, ladies and gentlemen. It is a great pleasure to warmly welcome each and every one of you to this special occasion. Today marks not just a gathering, but a celebration of shared purpose, collaboration, and new beginnings. We meet at a critical moment in our region's journey, and a moment that calls for honest reflection, bold leadership, collective action. Our team today, and I quote, "Delivering critical health care amidst security crisis and the acute shortage of nurses and midwives, the role of stakeholders," unquote, speaks directly to the life experiences of many Ghanaians and to the future of our health system. Madam Chair, Ghana's healthcare landscape continues to evolve, yet we face persistent and measurable gains in our outcomes over the years. Recent data shows worrisome trends in maternal and newborn health with stall progress and even regressing in key areas. According to the Ghana Health Service 2024 and 2025 report, institutional maternal mortality increased significantly, indicating that efforts to save mothers' lives have stalled rather than accelerated. The coverage of skills delivery, a crucial indicator of maternal care, declined from 60.6% in 2023 to 55.3% in 2024 and continued into 2025, a sharp reversal that should concern us all. These setbacks remind us that health outcomes are not abstracts. They represent lives lost, mothers who never held their babies, and families left in grief. Honorable Minister, at the core of these challenges are the people who deliver care, the nurses and midwives, whose roles in our health facilities cannot be underestimated. In Ghana, nurses and midwives make up over half of the public health workforce, and yet the country suffers major staff imbalances and shortages, particularly outside the urban centers, including the Upper East region. In many chief zones, the cornerstone of community-based primary care, many facilities in the Upper East region are unable to meet the requirement of having even one midwife on site, leaving women and children without essential care close to home. Madam Chair, this shortage is not just a matter of numbers. It is a matter of distribution and opportunities for nurses and midwives. Skilled health workers overly clustered in urban areas and in fewer regions, whilst rural and remote regions like the Upper East region operate with dramatically fewer nurses and midwives, doctors and skilled clinicians per population. Moreover, Honorable Minister, Ghana paradoxically faces both shortage of nurses and midwives in the workforce and a growing backlog of trained professional nurses and midwives awaiting employment. Reports indicate that over 74,000 trained health workers, including nurses and midwives, remain unemployed, with this number potentially rising to 180,000 in the year 2028 if situation is not urgently addressed. Madam Chair, ladies and gentlemen, the narrative above point to a systemic disconnect in workforce planning, and we train professionals, but we do not always provide opportunities for them to serve here in the Upper East region, where they are most needed. This situation fuels Ghana's healthcare brain drain, as health professionals seek opportunities in urban regions and overseas, leaving behind overstretched colleagues and placing greater strain on health facilities that are already struggling. And when nurses and midwives are forced to work without fair compensation, incentives for rural services, or safe working conditions, the result is lower morale, industrial actions, and compromised patient care. Ladies and gentlemen, we saw this earlier in 2025 when section of nurses and midwives across the country took industrial action over conditions of service and allowances, whose implementation had been delayed from previously signed agreements. The strike brought public health facilities to a standstill, pushing patients into private facilities and stretching an already fragile system. Madam Chair, even when the strike was suspended and services resumed across many hospitals, the episode laid bare the reality. When our gala nurses and midwives are underpaid, overworked, and undervalued, patient care suffers, and so does public trust in the health system. Honorable Minister, what does this mean for delivering critical care in the Upper East region, especially in environment where insecurity, resource limitation, and geographical inequalities compound one another? This calls for stakeholder collaboration and strategic workforce planning and protection. Our nurses and midwives must not only be trained, they must be employed, fairly compensated, and supported through their career developments. The backlog of unemployed nurses and midwives must be urgently addressed with sustainable funding commitments to absorb these professionals into the Ghana Health Service and its agencies, especially under deserved regions like the Upper East region. Honorable Minister, the government must show commitment in implementation of rural deployment incentives as contained in the signed Conditions of Service Agreement. Also ensure equitable and better distribution of nurses and midwives in the region and the country as a whole. It cannot be that the majority of skilled health workers are concentrated in urban regions, whilst the community who go without safe delivery and emergency care. Investment must be made so that health professionals are motivated to work in areas where they are most needed. Madam Chair, stakeholders must ensure that all health workers, especially those in precarious and insecure districts in the region, have better protection, safety, and support. Security crises may be less prominent in other regions than in some conflict-affected districts in the Upper East region. But health workers everywhere deserve environment where they can serve without fear and with the resources necessary to do their jobs efficiently. Honorable Regional Minister, communities, traditional leaders, and local civil society must play their roles by recognizing and valuing contribution of nurses and midwives. Community support increases uptake of services and fosters safer working environment. Finally, Honorable Minister, development partners, the private sector, and the academic institutions must help strengthen the health system not just through funding, but through collaborative programs that improve the training and mentorship, supply chains, and facility information system, all of which are essential for quality healthcare delivery. Ladies and gentlemen, delivering critical care amidst a shortage of nurses and midwives is not just a technical challenge. It is a moral imperative, and we cannot talk about progress towards universal coverage, maternal mortality reduction, or child survival if the skilled professionals who make these outcomes possible are left unsupported. Nurses and midwives. Our nurses and midwives are not merely numbers on a payroll or faces in statistics. They are hands that hold the hand of a frightened mother in labor, the calm voice that's suiting a new baby, and the steady presence in the hours between life and loss. Therefore, let us commit as policymakers, administrators, communities, and partners to invest in the workforce that stands at the forefront of healthcare delivery. Let us ensure that the story of Ghana Health Service System is defined not by its shortages, but by its resilience, equity, and compassion. We owe it to every mother, every newborn, and every family in this nation. Thank you very much. Long live Ghana, long live Upper East Region, long live the UPNMG, and long live nurses and midwife solidarity. Thank you.